The following is a paid commercial program paid for by Currie Health and Wellness Diagnostic Center. The opinions and views expressed in this program belong to its sponsors and are not those of this station or their affiliates or employees.
Hi folks, I'm Dave Woodman and I'm here with Dr. Keith Currie. Dr. Currie's an Arkansan, you know, U.S. Air Force veteran. He's in his 18th year of private practice right here in Arkansas, and many of you have seen him on television over these years and heard the stories of his patients sharing how he changed their lives. Some of them have even said that Dr. Currie saved their life. Well, one of those patients, Michael, is here with us, and like many of you, had severe low back and sciatic nerve pain that took him to see Dr. Currie. His story is next, right after I remind you, as I always do, that Dr. Currie wants to send you a free report on some of the conditions that could be affecting you. Severe low back pain, hip pain, scoliosis, spinal stenosis, sciatica, leg pain. Get a pen and paper, jot down the phone number at the bottom of your screen, and then call that number to request the report. It's a $19.97 value, but it's yours, absolutely free. Just could be the most important phone call you'll ever make. Well, Mike, I mentioned to our viewers that you had really severe low back and sciatic nerve pain in your leg. How serious was that? How was it affecting your lifestyle?
So I'm in construction, and on April the 15th, my L5 herniated, and I was not able to do my work at the capacity that I was. I'm a sole provider for 5 people, and you know, things were taking me 4 or 5 times longer if I could do them.
All right, so you were in pretty bad shape, but you you did have several options. In fact, among them were injections and even back surgery. What made you decide to see Dr. Currie instead?
Well, I guess I got to give credit to God first. My wife, after going and seeing my doctor, my general practitioner, he said, "You need surgery." He sent me to a specialist. He said, "You need surgery." I said, "No, I want to go see my chiropractor." He said, "You need surgery." And my wife said, "Well, my former pastor had something done in Conway." So I called him up and I said, "What did you have done?" And he told me about Dr. Currie. He was a patient of Dr. Currie's. And so that personal testimony says, you know, you got to go check it out. And then when I talked to Dr. Currie, I just, like you mentioned before, the honesty, the upfrontness of Dr. Currie, I was like, you know, this is something I've got to try.
You know, this television advertising is great, but word of mouth, Dr. Currie, is really good. Now, I know there are a lot of people watching right now, Mike, who would say, no way, when you tell them that you were able to get completely off your pain medication after getting your treatments from Dr. Currie.
Absolutely. So I was on tramadol twice a day, gabapentin 3 times a day, ibuprofen, Aleve in between, and never got full relief. After the 3rd treatment with Dr. Currie, no pain medicines, no over-the-counter, completely medicine-free.
Folks, that's what we've been talking about for several years now. Dr. Currie, what may I ask you what the highlight was for you in treating Mike?
Well, to be honest with you, Dave, it's, you know, of course the relief, but I mean on a personal level, when Devin, his pastor, former pastor, you know, sent him to me and he told me that, there's no greater compliment that someone can pay me than to send someone that they know or love or care about to me. And I mean, I'll never forget my very first patient that I ever treated. He walked in years later with a personal friend of his from Magnolia, Arkansas, and that's not close to Conway.
Right.
And he walked in with her and said, "Dr. Currie, I want you to do the same thing for her that you did for me." And so from a personal level, that really meant a lot. And then just seeing how quickly that he was able to do normal work, like he went to work. I mean, for real, he's a carpenter. I mean, he went to work, Dave, and was working through the program. He didn't have a 6-month hopeful recovery after a failed surgery or anything like that. He worked through the treatments.
So this has been about, I think you finished your treatment about 6 months ago. You're back on the job, you're carrying lumber around, you're doing your job.
Yeah, so my last treatment was actually August the 3rd, and since then I've gotten 2 cabins in the dry. I've built a 70-foot retaining wall with railroad timbers, so I'm really putting his work to the test.
Man, that is wonderful. Mike, thank you for coming in and sharing your story.
Absolutely.
Folks, if you're in pain, do something about it. Call the number on your screen, order Dr. Currie's free report to find out how you too may avoid surgery in favor of Dr. Currie's non-invasive treatments. We'll see you next time.